So to make up for your clinical experience that you were unable to do due to the COVID, we're going to have you do a total of 10 dynamic simulations. The state of California has approved of this, so this is in lieu of you guys going to the hospital and then going out on the ambulance. What's going to happen is when you do come in for these on campus, we'll divide you up into teams of 2 students. You'll go into a room, you'll assess and treat a patient based on the scenario. When you're done with that assessment and treatment, you and your partner will go outside and you'll find a place to sit down and fill out one of these forms. These forms are found in your clinical experience orange packet. And it's very similar to what I have here on the screen, so it should cross over pretty well. Remember to put your name and your instructor's name at the top of the form. Based on the information you received during your simulation, you're going to write in the person's age, whether they're male or female or other, their weight of the patient if that's appropriate for the situation, their chief complaint, and a brief history of the event. So in this case, you have this person with general weakness. He called because he can't get out of bed this morning. He's been feeling sick the last couple of days. OPQRST, whatever is appropriate. If this is a medical patient with some type of complaint that it works for, use it. So it's a slow onset. Nothing makes it better or worse. It just feels really, really weak. It comes and goes. It's a 10 out of 10 scale, and it started about 2 hours ago. You'll then obtain at least 2 sets of vital signs. Remember to timestamp correctly. Document your vital signs as appropriate for the patient's care and treatment. Notice the gentleman's blood sugar is 550. His temperature is 102.6 tympanic. So he's got a lot going on here. If you do give oxygen, there will be an update. So his room air saturation was 90%. You applied oxygen, it went to 92%, and then by the time you did your 3rd set of vital signs, it went to 94%. Every patient needs a Glasgow Coma scale, so there's the scale right there. There's your total. He's 15. His eyes are open spontaneously. He's fully oriented, and he follows commands. And this area right here at the bottom, you would write in or circle the appropriate medical history. In this case, he has high blood pressure, he has diabetes, he has asthma, whatever it might be, or if it's not in that list, write it in above. Medications, if he says none, write none. Allergies, you can circle the ones that are appropriate or write in the one that he or she might tell you. Treatment that you provided, so you provided 4 liters via nasal cannula, and treatment is just comfort care. Make sure at the bottom that the proctor, the person who tested you on the simulation, signs the bottom, initials it, and dates it. Remember, you need a total of 10 patient contacts, 5 medical and 5 trauma. Remember to bring your orange packet and also a black or dark blue ink pen to fill these out.